about that, excited to learn about this new technology. We're going to be bringing that back here to pure plastic surgery as well. So all of the innovations that are going down in South America and Bogota, Colombia, by the world-renowned Dr. Hoyos, we're going to be learning all those skills and techniques and technologies. And we're going to bring all of that back here to pure plastic surgery, so that all of you can come down here to Miami and experience all of this without having to leave the country, having to go to Colombia or some other country for all that. Okay, so super excited about it. I'm actually going to be leaving here quite soon, in about 30 minutes or so. I got to go straight to the airport so I can fly down to Bogota, spend a few days there, and then I'll be back, of course, for Monday. All right, so I'm happy to answer all the questions that you may have. So if you have questions, go ahead and ask them right now. And if you like, we can go fairly rapid fire so I can get to as many questions as possible, because I know a lot of times when we do this, there's just a few questions we can't get to because there's just so many. So to all my followers on Instagram, my Instagram family, you've been following me for many, many, many years. Go ahead and ask your questions right now. And to all our new people here on TikTok, we only started doing lives on TikTok more recently, but it's been growing by leaps and bounds. I thank you so much, my TikTok family, because we started with like 200 people watching the lives, and now we're up to 2,000, 2,000 people watching these lives and getting more involved and asking all your questions. So if you have questions regarding plastic surgery, with anything that has to do with it, from head to toe, from pre-op to post-op, just let me know.
All right, first question.
Yes.
Hi, Doc. I just joined. Can you please just let me know what Quantum is? Because I want it, if you're offering it.
Oh, yeah. So that's what I'm saying. So I'm going to Colombia, and this is the latest technology in skin tightening. It's offered by the same people that do the Body Tight In Mode, but it's basically their next generation. It's a lot more powerful, which means that I can tighten the skin better, and which is better for you, obviously. And what's also better for me is that I can do it a lot quicker. It's a lot more efficient, a lot faster. So that means less time in the OR, which means, of course, less risk. I don't like to keep my patients in the OR much longer than 3 hours, and that's going to allow me to get through the procedure much more quickly, much more efficiently, and also with better skin tightening there. So we can use it. We can use it for the abdomen, we can use it for the back, the arms, the thighs, for all of those areas.
Hi, Doc. Does the faja kill the fat? And when you get massages done, won't you be lying on your butt?
Right, so the faja should not kill the fat, okay? So that means you have to have the appropriate faja, okay? And what does the appropriate faja means? It means that it has to be tight in the body and in the waist. You want that because you want to shrink that waist down as much as you can. But it has to have like that loose, more stretchy fabric for the hips and the buttock, okay? So you want to make sure you're in the right faja, and there are also different stages of faja. At the very beginning, you're going to have your stage 1 faja, which is actually fairly distensible. It's not going to be as tight. And then you're going to switch over to that stage 2, which can get much more tight in the waist area, but you still need that kind of softer fabric for the hips and the buttock. And then once you pass 6 weeks and it doesn't matter as much, you can get potentially a stage 3 faja, which is going to be even tighter, and that can be a little bit tighter in the buttock and hips. At that point in time, whatever fat was going to survive has survived, okay? And then the second part of the question was, what was the second part?
When you get a massage, don't you lay on your butt?
You actually don't. If you had a BBL, you're not going to be laying on your butt for your massage. So they massage, when they massage you, of course, in the back, there you are laying on your tummy. They'll do all the back part, but then when they're going to massage the front part, you're typically, sometimes either sitting on a BBL pillow or standing. There's different ways that they can do it, but they do it in a way such that you're not putting pressure on the buttock and hips.
Does somebody help us to transition to faja number 2?
Well, yeah, we don't do it personally here at Pure Plastic Surgery, but we do have a couple places, and specifically, 2 places that we send you to down here in Miami, which are nearby, where they do help you a lot. You're going to go there, they're going to take great care of you, they're going to take all your measurements, and they're going to fit you into the best stage 2 faja. And if you have time, if you do it such that your post-op day 5 appointment, you have some time between that post-op day 5 appointment and your flight, which could be either like later that evening or the next day, then you'll definitely have time to go there and get appropriately measured to get the best stage 2 faja for you.
When you start the process, how do you know that you're getting a faja that it's the right fit?
Well, the stage 1 faja, we're going to give that to you, so that's going to be based on how things look in the OR once we're done with the procedure. And remember, that stage 1 faja, it's not going to be super tight. So don't worry about it if you don't feel it like it's super snug. I actually don't want it to be super tight because I just beat up your skin for 3 hours, right, doing the liposuction. And so the skin is very sensitive at that point in time. So we just want to give you some support. We want you to feel, we want you to feel supported, but we don't want it to be overly tight that may cause problems with the skin, okay? And then, like I said, for the stage 2 faja, we'll send you to a place where you can get all your measurements and get the appropriate fit for you.
How do I know if I need a tummy tuck or if I can just get a BBL?
That's a great question. It's a question that we get pretty much every single day because there are quite a bit of those what we like to call borderline cases, okay? Now, what is not a borderline case? Let's start with that. So we have a lot of excess skin, like a ton of stretch marks. The skin's like overhanging. It's super, super loose because you've had potentially multiple pregnancies or pregnancies of multiples, like twins and triplets. Or if you had massive weight loss, you've lost 50, 60, 100 pounds. Then you're going to have quite a bit of loose skin. We call that severe skin laxity. And if you have severe skin laxity, then you're a candidate for a tummy tuck. Another reason you're a candidate for a tummy tuck is if you have separated muscles or weak muscles. So the muscles can be, or it can be both. You can both have separation and weakness. But if they're separated, the only way to put them back together is with the tummy tuck. And if they're weak, the only way to tighten them up and get that flat belly so that you don't look like you're 3 or 4 months pregnant all the time is also the tummy tuck, all right? So severe loose skin, separated muscles, or weak muscles, you're a tummy tuck candidate. Now, if you have moderate loose skin, no weakness in the muscles, no separation in the muscles, then potentially now with these new technologies like quantum or J plasma, then you can be a candidate for Lipo 360 or BBL, and we can use these technologies to help with the skin tightening.
What is the percentage of fat survival?
So in my practice, what I've found over the years, and I'm talking the last 7 years and over, I don't know, I'm probably up to about 2,500 cases by now in terms of BBL. The fat survival is about 70, so 70. The fat survival I found on average is about 70%, okay?
How do you know if it's separated? I think she's talking about
the muscles. Yeah, sometimes you can feel it, like if you put your fingers in the middle there, you can feel that there's a space in between those muscles. There really shouldn't be a space there, at least not any bigger than like the width of your finger. So anything larger than that is muscle separation. Or sometimes like when you're like getting up and you see like a bulge that goes right along the middle there, that means that the muscles are separated and you have weakness in between the muscles. That's called a diastasis. Now, if you want to really know for sure, what you can do is you can get a CT scan of your abdomen and pelvis, and that will actually look and tell you if you have muscle separation or what we call a diastasis recti.
What happens if my doctor won't get a chest x-ray or EKG?
Then we'll have to figure it out, right? So if you're over 40, that's when we recommend the chest x-ray. So not everyone needs a chest x-ray. If you're under 40 and healthy and not a smoker, then you don't need the chest x-ray. But yes, everyone needs an EKG. And an EKG honestly is like something that's super easy. Like it shouldn't be that difficult to obtain. It takes about literally 5 minutes in the doctor's office. So that is something that we are going to need. We'll require an EKG from all our patients. Okay, why? Because we've had episodes in the past where we've done that and people have like arrhythmia, so like odd rhythms that they don't even know about. And then that can become dangerous when you add that to general anesthesia, right? And so it's super, super important. Remember, safety, your safety is our #1 priority. Okay? And that's why we do go the extra step and we do require EKGs for all our patients.
How do I know if I need a tummy tuck and Lipo 360? I am 5'8", 147 pounds. I was cut in 1992 from a laparotomy.
From a laparotomy. So you probably have that incision all the way up and down through here, right? So how do you know if you need both? Well, again, we go back to that, right? Do you have severe loose skin? Do you have weakness in the muscles or separation in the muscles? If the answer to any of those questions are yes, then you need your tummy tuck, and I always recommend do your tummy tuck first. Okay? And then come back 3 months later so you can do your Lipo 360 plus minus fat transfer. So it's going to be a Lipo Sculpture 360 or BBL. Okay? But I always recommend tummy tuck first, 3 months later, Lipo 360 or BBL.
Can we request a vertical shaped belly button when getting a tummy tuck?
Yeah, you can request it to a certain extent. I'm pretty well known for very natural looking belly buttons. So you want the belly button to almost look like an inverted U. Sometimes the ones that are like too vertical and they look a little bit like a slit, those don't look so natural. So yeah, of course we can discuss that. If you prefer that look, it's something that could be done, but I don't think it's the most natural look overall. I think the most natural belly buttons are the ones that look like a regular belly button, right? A little bit of roundness, like an oval shape. That's what we try to create, and also try to put that incision as kind of inside or deep as possible, so that the scar around that belly button is not so visible from the outside.
What is your BMI requirements, and does that apply to every surgery that you offer?
All right, TikTok question, right?
Mm-hmm.
Yes,
Yes.
come on, keep them coming, TikTok. So my max BMI, I'll write it right here. My max BMI is 30. Okay? So that's the max BMI for me. So if you're over 30, we can work with you. We can help you kind of lose the weight so you can get to that 30. But that is my maximum BMI there. And then what was the second part of that question?
Does it apply to every surgery you offer?
Yes.
BMI, or does it change?
No, the max BMI does apply to every surgery that we offer, or that I offer here. Now, different surgeons have different criteria. So I know for a fact that Dr. Vidal and Dr. Wigger, if they go up a little bit higher in the BMI, I believe they go up to 33. So every surgeon can be a little bit different. But there is going to be a limit. Typically not more than 33 for anyone here at Pure Plastic Surgery.
What procedure works to get rid of protruding stomach?
Okay, so first of all, why is the stomach protruding? So there's usually one of two reasons. One, it's either a diastasis, okay, so muscle separation with weakness of the muscle, or two, it's a hernia, a true hernia, right? How do you figure that out? You probably need a CAT scan of the abdomen and pelvis to take a look and see what's going on. If you have a true hernia, that hernia needs to get fixed. You got to fix the hernia before you do anything else. Sometimes if the hernia is not too big, you can fix it at the time of your tummy tuck. But if it's a large hernia, you need to go to a general surgeon who can fix that hernia for you. Now, if it's just due to separation and weakness, then we can fix that at the time of your tummy tuck. No problems there. All right? And now the third thing, though, if you have a stomach that kind of bows out like this, and this is more for men than it is for women, but a stomach that kind of really bows out, sometimes that's due to what's called visceral fat. Visceral fat is the fat that lives with the organs, right? With the liver and your colon and your intestines, right? The fat that's deep. If you have a lot of visceral fat, there's no surgical solution for that. All right? The only way to reduce visceral fat is with diet and exercise.
Why do some women end up with the T-scar after tummy tucks?
Those are for patients that have, they have some loose skin, but it's not so loose that they can bring it all the way down to here, right? And so what sometimes happens is that as you try to stretch that skin down, it doesn't reach all the way to the low point where you want that low incision to be. And so that particular case, you may have to leave a small vertical scar. At least for me here, it doesn't happen very often. I mean, it may happen, I don't know, once a year or twice a year. But for the most part, it's fairly unusual for me to have to leave that vertical scar after a tummy tuck.
Can you do a BBL on a lupus patient in remission with good labs?
So unfortunately, I don't take patients that have lupus or any sort of autoimmune type of disease. Okay, at least not in the setting that we're in here, which is an office-based outpatient surgery setting. And the reason for that is because those autoimmune diseases, such as lupus, do increase the risk of things like potential issues with wound healing, or skin necrosis and skin dying, and even infection. So it does increase the potential complication rate there.
Can I do a second tummy tuck, or is it one and done?
It's not one and done. You can certainly do a second tummy tuck, and I've done them before. I've done them either because we have to revise a tummy tuck that was done by somebody else, or the patient had a tummy tuck and then wasn't planning on it, but life happens, right? And she gets pregnant again. And so then everything gets stretched out and you got to go back and do that second tummy tuck. Or for whatever reason you got a tummy tuck and then unfortunately you gained a bunch of weight and then you were able to lose the weight all over again, and then that could be another reason to do a second tummy tuck. So certainly it can be done.
How does J plasma work, and does it cause more pain?
So J plasma uses RF energy, but it adds to that. It uses RF energy plus the helium plasma. Okay, so RF energy plus helium plasma. Helium is a gas that it uses to create that. And so with the combination of these two things, it helps heat up the skin, which will then creates this kind of inflammatory response, which allows the skin to increase its collagen and also to retract better. Okay, kind of a long-winded explanation for that, but that's the way that it works. It does. It's very, very powerful. It can contract the skin up to 60%, which is very, very high for a machine to be able to do, as opposed to a tummy tuck, for example. And does it create more pain? No. The pain is going to be the same. The pain is related more to the lipo sculpture part of it and not the J-plasma part of it. So whether you do J-plasma or not, the pain is going to be the same.
This question's from the same person who asked about your BMI. She wants to know, do you help patients reach or advise to reach their 30 BMI?
Yeah, we certainly do, and we can do it, with just advising, nutrition, etc. But we can also offer and prescribe the GLP-1 medications, the ones that are like similar to Ozempic or Mounjaro. We can do that as well. So yeah, we can certainly help you out so you can reach your goal, and so then you can then have surgery with us.
Do you offer mini tummy tucks or regular extended only?
I offer all sorts of tummy tucks. So let me just name all the types of tummy tucks that we offer. Certainly the mini tummy tuck, the regular tummy tuck, the extended tummy tuck, the reverse tummy tuck, and the biggest one of all, which is for our massive weight loss patients, the fleur-de-lis tummy tuck as well. So we offer all of those. Now we have to determine which is the best type of tummy tuck for you, right? All right. Just because you want a mini tummy tuck, it doesn't mean that you're the best candidate for a mini tummy tuck. In fact, very few people are good candidates for a mini tummy tuck.
Let's see. Do you accept patients with tachycardia?
To a certain degree, yes. It is what we just call a sinus tachycardia. So there's nothing really wrong with the heart. There's no what we call an arrhythmia. So the rhythm is normal. We call that normal sinus rhythm. So if you have just a normal sinus rhythm that happens to be just a little bit fast, then we can accept the patient. But we're going to ask for a couple things. We're going to ask for your EKG, and we're going to ask for a cardiac clearance. Okay? And if those two things check out, then we can usually move forward.
Do you use ultrasound technology on all BBLs you perform?
That is my signature. That is me. When you think about ultrasound guided BBL, my face should pop up in your brain, okay? Because I'm basically a pioneer of this technique, okay? I've done more ultrasound guided BBLs than anyone in the entire US. I've been doing this since 2019, and now I used to say about a year ago I've done over 2,000, so now it's way over 2,000 ultrasound guided BBLs under my belt, and I have never, not once, had an issue with a fat embolism or death because of that technique.
If you gain weight for surgery, should you continue to eat the same amount of calories after surgery?
So you may actually have to increase it a bit, right? Because remember, your body has gone through the trauma of surgery and it's now in recovery mode. And so when the body is in recovery mode, it uses more calories than you normally would. So you even have to increase a little bit the amount of calories you normally take just to maintain your weight while you're recovering in those first 6 weeks. After the 6 weeks, you can probably just go down to your regular kind of calorie count.
How does your consultations work if you live in another state?
Right, so actually most of our patients come from another state. So we have all of this down pat. Over 90% of our patients come from another state. So how does it work? Well, the easiest way is to go to our website. So go to www.puroplasticsurgery.com, and there you're going to see a little link that says, start your journey, book your appointment, or virtual consultation. But if you're here on TikTok, just go to my bio, and you're going to see a link there that says virtual consultation. That's the easiest thing to do. Just go straight there, boom, you're right where you're supposed to be. Fill out the questionnaire, send us your photos, and then we're going to take it from there. You're going to get a call from one of our coordinators, and she's going to take you by the hand and lead you every step of the way.
What is your take on post-op lymphatic massages after surgeries like lipo, BBL, and tummy tucks?
I am a huge believer in post-op lymphatic massage. I think it's actually necessary. I actually always say that the surgery part is only about 50%. The other 50% is the post-op care. It's just as important as the surgery itself, and that includes lymphatic massage. So for all my liposculpture cases and for all my BBL cases, I am going to have my patients do a minimum of 20 massages. Sometimes they need more, but 20 is the minimum to really optimize your results. And then for my tummy tuck patients, usually we need a little bit less, but usually about 10 to 12 massages are sufficient for that.
Is it true that African American patients have more fibrous skin than others, which makes it difficult during lipo?
I've seen all types of skin, and it doesn't necessarily have to do with the color of the skin or the race or things like that. But yes, it's definitely true that there are some patients that are more fibrous than others. And it's definitely true that some fat just comes out much more easily in certain patients, than others. But I haven't necessarily been able to correlate that to ethnicity or color of the skin or where they're coming from. I just seen a lot of variations, but you can't really pinpoint exactly who's gonna have what.
Next question is, did you train with Dr. Hoyas?
So I have. I've already trained with him once, where we did the whole Total Definer course, which is the course that's dedicated to HD or high def liposculpture, and now so I know him well, and now I'm going back for a short visit this week, where we're just going to talk a little bit more, do a little bit more training, learn more about rib remodeling, then more about quantum, and just exchanging ideas and information there, and bringing all that back here to Pure Plastic Surgery.
Can we request extra add-ons during pre-op?
Yeah, you certainly can. So that is something that can be done kind of last minute during the pre-op process. So obviously that's why we like to do our pre-op, or like to know, we should, I think everyone should, but we do our pre-op the day before surgery, so that when I can see you, I can examine you, we can have a discussion, we can think about your goals, and then determine whether we need to either change something or add something at that point in time to make sure that we're able to achieve your goals.
Do you use drains for BBL? If yes, do we go home with them, or are they taken out before we discharge?
Yeah, so I like to use a drain for the BBL. Again, it's a surgeon preference type of thing. Not all surgeons do. I like to use the drain because I think it's easier for the massage therapist than to kind of push the fluid out through that drain, and it's cleaner and everything else. So you'll have a drain in that lower belly area, but you won't go home with it. When you come in for that post-op day 5 visit, a lot of that fluid now has been drained out, and you don't really need the drain so much anymore. So we'll remove the drain in that post-op day 5 visit before you go home.
All right, another question about drains. Can you explain why would a drain come out when you're having a tummy tuck after surgery?
So why would a drain come out inadvertently? Usually it's because it gets tugged or pulled, right? So the drain typically has a little stitch that kind of holds it attached to the skin. But sometimes if it gets caught, like in the door, or it gets stepped on, or just gets pulled for whatever reason, sometimes it can come out inadvertently.
Do you have someone that you recommend for massages in the area?
Definitely. Well, if you're coming to us, we highly recommend our own massage therapist, Jessica, or otherwise known as Bestie Jeannie. She's got terrific hands. I think everyone who's had a massage with her is just like ecstatic. She is super, super helpful. She's been in this business for a long time. She has a lot of experience as well. So she is the best. We highly, highly recommend her. And then, if you're elsewhere, we can potentially recommend other people as well.
Do you perform BBL reconstruction after weight gain?
So I don't know if that's specifically. I mean, for you're asking, what I recommend is to just send in your information and your photos so I can do an evaluation, determine your goals, and see if we can help you. But what we do, and we're one of the few people that do it, and we're kind of known for being one of the few people that can actually do this, we do BBL reductions and reshaping. Okay? So if you had a BBL in the past and it was overdone or whatever, you just don't like it anymore, you feel like it was overdone or the shape is not what you like, then yes, we are very well known for BBL reduction and reshaping, so we can reduce volume, we can reshape things, we can get you to a place where you feel more comfortable in your body, because back in the day, sometimes they were doing like these big diaper booties or amp booties and not matching into your thighs and stuff like that. So if you had that done elsewhere and you want to try to fix it and feel better about it and be more comfortable in your clothing, that's something that we could potentially do for you.
Are there scars with a BBL?
There's always going to be a scar anytime you make an incision, no matter how small it is. Okay, so for the BBL, there are going to be little tiny scars. They're all very, very small. They're less than 5 millimeters, so little tiny incisions. Well, there's going to be a few of them. All the areas where we have to do the liposuction and or infiltrate the fat. So there's going to be typically 3 in that suprapubic area, very down low, 1 tucked inside the belly button, so those are very well hidden. No one's going to see those. And then in the back, there's going to be 1 in between the butt cheeks and 1 sometimes hidden in the armpit area or sometimes in the bra line area. Again, tiny incisions, very well hidden. And then the ones for the fat transfer are going to be down in that gluteal crease, so that crease between the lower buttock and the upper thigh. And we can put a tiny incision there as well. The whole point is to make as little incisions as possible and to minimize them and to put them in areas that are super easy to hide.
All right, quick update. We have 2 minutes left before you have to go.
Okay.
So we'll rapid fire. We have a lot of questions.
Oh, we're going to rapid fire now?
Well, let's do it.
All right.
For patients flying to Miami and book their own hotel, is there a possibility that we could book our own lymphatic massage that can come to the hotel? And could you recommend any when we arrive at your facility?
Okay, so if you're coming down to Miami and you're booking the hotel package with us, then you're gonna get Jessica. And honestly, there's no better massage therapist than that. Okay, so you're gonna get Bestie Jeannie. That's really not an option there because it's all kind of part of the package. Okay. Now, if you're coming down to Miami and booking just some other hotel or your own Airbnb or your own accommodations, then yes, you have the option. You can of course try to book the massages with us and Jessica and Bestie Jeannie. Or you can book your own massage therapist, okay? In which case, there are other good options here in Miami as well.
All right, rapid fire. Do you do drainless tummy tucks?
So I don't, but Dr. Wigriff does, okay? So you guys may know Dr. Wigriff. He's been with us for a bit over 2 years now.
Mm-hmm.
And he is an expert in drainless tummy tucks. So if that's what you really want, then I recommend, again, fill out that virtual form. Give us your questionnaire, send your photos, and one of the questions is going to be which doctor. You put Dr. Wigriff for a drainless tummy tuck.
How do patients sleep if they have a BBL and breast aug together?
Well, that's a hard question, right? And that's why I don't do that. I don't do that. I know other surgeons do. I don't recommend it, right? Because of that, right? It's super tough to recover. You're going to compromise something. You're going to compromise typically the BBL because you certainly can't be on your chest with new implants. So you're going to be putting some amount of pressure to your hips and the buttock, which is going to compromise the results for the BBL. It's going to make the recovery a lot tougher for you. And also here in Florida, we do have certain rules. So if you're doing a breast augmentation, you shouldn't be removing more than 1,000 cc's of fat via liposculpture, which means that you're limited as to how much fat you can remove. You're limited as to how much fat you can place. So again, compromising that BBL result. Okay. And so I don't recommend it. If you need both, you got to separate them out by 3 months.
Thank you. All right, 2 more questions.
Yeah.
Are you board certified in plastic surgery?
I am board certified in plastic surgery, and if you want to look me up, you can go to the website, to the American Board of Plastic Surgery, and just make sure you put in my full name. What is my full name? Anybody know? It's Stephen.
You got wrong answers.
Yeah, Stephen Alexander Earle.
Stephen.
The S stands for Stephen. Okay, so Stephen Alexander Earle. Put in my full name, and you'll see my certificate right there.
Hi, doctor. I have a consultation set up with you in a few weeks. I want a breast aug, but I do not want any scars. Do you put it in through the armpit?
So I don't do that. So I feel like the best incision is what we call the inframammary fold incision, which is the one just in that breast crease there. I do make a tiny, tiny incision, no more than 3 centimeters, okay? So I can do it through a very tiny incision through there. No one's gonna see it. It's gonna heal super, super nicely. And that is my preferred approach. It's the approach that has the least amount of complications, the lowest capsular contracture rate, and the lowest risk of infection.
Thank you so much, doctor.
All right, everybody, that was awesome. I really enjoy sometimes these kind of rapid fire questions. I try to answer as much as possible. I want to thank my IG fam. I've always been there for many, many years now. TikTok, now you know what it's about. I can answer all your questions, and we do this every single week. So make sure you come on Wednesdays, typically around 4:30 p.m. All right, and we'll be able to answer all of your questions regarding plastic surgery on Hump Day with Dr. Alex Earle. I'll catch y'all later. Ciao.